Hello everyone, I'm Dr. Jiria Asis Polog. I am the current internal chief resident of Department of Anesthesiology. Currently, our department has 12 active consultants, 3 visiting consultants, and we are also 6 official first-year residents. Here we have our conference room with computer and internet capable of accessing our Endicus account. We also have our mini library. It's filled with latest edition of reference books, and we recently had our journal subscription for British Journal of Anesthesia, which is accessible to both the consultants and the residents. So in line with our Anesthesia 2022 training, we have the following activities: the daily hybrid endorsements, the wet clinic in which we perform the peripheral nerve block tape. We also have our Tuesday and Friday conferences in which we usually do our weekly journal appraisal, residence lecture, residence case management, consultants our lecture. Also the monthly audit, monthly morbidity and mortality conferences, the DOPS or the so-called direct observation of procedural skills, written and oral exams, and lastly, our online webinars. I would like to welcome you all to our operating room complex. So please follow me around as I tour you. This is our pre-anesthetic care unit or the pre-op area. This is the place where we usually do our pre-op assessment for emergency cases. So I humbly welcome everyone to our operating room complex. Currently, we have 5 functional operating room theaters, 4 of which are inside this OR complex, and the remaining one is outside the OR complex. It is usually used for extreme emergency cases. So this is our operating room 5. This is our operating room 1. This is the operating room 4. This is our operating room number 2. This is dedicated for ambulatory surgical cases. So we are here right now at our post-anesthesia care unit. Currently, it has 9-bed capacity. And adjacent to it is our delivery room and our neonatal intensive care unit. We are usually called here for labor analgesia and sometimes for difficult intubation for neonates. So behind me is our intensive care unit. We currently have 11 beds and 2 of which are allotted for critical care patients. Behind me is our OB-Pedia complex. It is a 7-story building with a 120-bed capacity. The first floor is allotted for transition ER. The second, third, fourth, fifth, sixth, and the 7th story are allotted for OB and Pedia wards for private and charity. So we are here right now at our APMC emergency complex. Right beside me is the Surgery, Emergency, and Trauma Center. Behind me is the Pediatric Emergency Room, and just adjacent to it is the OB-GYN ER complex. As anesthesia resident, we are usually called here to render anesthesia service such as management of difficult airway. So this is our APMC ENT OFTA complex, and as anesthesia resident, they usually call us to render our anesthesia service. So right now we are here at our endoscopy unit. We are usually called here for patients who are going to undergo EGD or colonoscopy. Inside here, we also have our ERCP room. We are usually called here for patients who will be undergoing ERCP under general anesthesia. So right now we are inside a CT scan room. Currently we have 2 functional CT scan machines capable of 64 slices. So as an anesthesia resident, we are usually called here for CT scan under sedation, especially for pediatrics. So this is our newly opened infectious disease and tropical medicine complex. It is equipped with negative pressure rooms. This is where we usually admit our COVID-19 patients. As you can see is our future cancer center. This will be equipped with pain clinic and interventional pain clinic. As an anesthesia resident in future, we will be called here for acute and chronic pain management.